It's 11 o'clock and good morning. My name is Eric Story. Jan, who normally moderates, is away today, so you have me. But I'm Eric Story from the Edmonton Pride Seniors Group. We'd like to thank you all for attending our weekly Aging with Pride discussion for 2SL LGBTQ seniors and allies. And thanks to our partners at SAGE and the Pride Center of Edmonton. Before I introduce our speaker, I'd like to acknowledge that we are located on Treaty 6 territory and respect the histories, languages, and cultures of First Nations, Métis, Inuit, and all First Peoples of Canada, whose presence gives us opportunities to learn and continues to enrich our lives. So in today's session, we'd appreciate if everyone could mute themselves so that we aren't distracted by background noises. We'll have time at the end for questions and discussions. So if you have any questions, please just put them into the chat and we'll get to them at the end of the presentation. And so now, with great pleasure, I'll introduce Lorelle Whittingham, who works for SAGE at the Community Relations Coordinator, and she supports and advances initiatives in the community engagement area of responsibility. Lorelle educates and engages seniors in the general public in SAGE's services, which include direct service provision, strategic program planning, fund development, and donor relations. In this presentation, you'll learn about SAGE Seniors Association's programs and services and how their community-based approach addresses individual challenges, builds on personal strengths, and connects seniors to information, resources, and each other. For over 50 years, SAGE has been helping seniors live and age well in their communities. So Lorelle, please take it away.
Thank you so much, Eric, for the introduction. Hello, everyone. I'll just share my screen here, get things going. Okay. I'm so happy that I have this chance to kind of share a little bit about what we do as an organization and also to reconnect with the Pride Center and Aging with Pride. SAGE has a long-standing relationship with the Pride Center as they helped us create the Over the Rainbow group many years ago. And that was a confidential discussion group at SAGE downtown at the physical building. And it gave the LGBTQ plus seniors, their friends, families, it gave them a safe space to connect, feel supported, and address any concerns or questions that they may have. And I'm so happy to continue this partnership with Aging with Pride. It's so necessary because it speaks to SAGE's holistic approach when working with seniors. Because many seniors come to SAGE for our social work programs and our resources, such as our life enrichment programs. It may be easier for some seniors to say that they're coming to a senior center rather than a Pride Center if they're not yet ready to tell their families or friends, but still want to feel supported and connected to the LGBTQ plus community. So I'm so happy that we're able to bring back Aging with Pride and that partnership. And it's kind of nice to see the history of our partnership with the Pride Center. So what I'd like to do for today is begin the presentation with a short video that outlines our unique community-based approach and the ways that we shape our programs and services to be senior-focused. I'll then go into some more detail about some of the different programs that we offer and share a few resources for you as well. So I'll just start this video here.
We all age in our own way, have different life experiences and backgrounds, unique circumstances, strengths, and challenges. At SAGE Seniors Association, our programs and services are designed to address individual challenges and build on personal strengths, so you can live and age well in your community. SAGE is a centrally located one-stop resource hub for seniors. We are a unique, community-based organization that is here to connect people to information, resources, opportunities, and each other. It all begins with meeting you and getting to know you. We are here to listen and to find out about what you want and need. Sometimes with services that address basic needs, like helping to secure safe, appropriate, and affordable housing, filling out government forms or preparing your income tax return, or applying for guardianship or trusteeship. Sometimes with programs and activities, like drop-in coffee groups, English as another language classes, music and dance lessons, day trips and celebrations, or pole walking and Zumba classes. You may even be in a situation where you are facing a life challenge or trying to manage a difficult life transition and need someone to help you figure it out. We know that everyone also has skills, abilities, and gifts to share. So we work with seniors here at SAGE and out in the community to help you make a difference. For 50 years, SAGE has been helping seniors live and age well in their communities. Adding social supports, activities, programs, and opportunities is just one more way we help seniors live healthy lives. We all
Okay. So as the video shows, our programs and services are designed to address individual challenges and build on personal strengths so that older adults can live and age well in their community. SAGE's vision is to build a community where all seniors are valued and have the opportunity to live according to their beliefs, abilities, and aspirations. SAGE's approach to achieving its mission of inspiring and supporting seniors to be the best they can be is to work in collaboration with community members and stakeholders to provide senior-driven programs and services. We are really building a community where all seniors are valued and have the opportunity to live according to their beliefs, abilities, and aspirations. So I wanted to first show this graphic. This is an eco map, and it's used to assess what resources an older adult is connected to and to identify whether each is a positive or negative influence in their lives. So this is one of the tools that we use, especially when it comes to our Aging in Place program. And on this map, arrows could be directed to identify the flow of energy to or away from the client. So an arrow pointing away from the client identifies an unmet need. And some of the areas is around home, health, transportation, finances, connection, safety, support and services, community, partnership, mental health. Some examples of using this eco map could be for transportation. Say the cost of owning a vehicle has increased, or you're dealing with understanding the impact of no longer being able to drive. So that's under the transportation area, and our social work team would kind of support you in gaining resources and information to kind of help navigate that. Another example of using the eco map would be thinking about one's home. So as housing options change as one gets older, you may decide to downsize or live in a different home setting. And so these are the resources that our staff can connect you with and information. Because SAGE is centered around working with a holistic approach, we're able to recognize that sometimes issues are not individual, they are systemic. One of the systemic issues we are facing is ageism, especially when thinking about ageism during the pandemic. There is a negative narrative that was created due to the fact that seniors are seen as high risk towards COVID-19. This negative narrative can create an overabundance of sympathy, making it difficult to perceive or hear what a person truly requires. Rather than seeing an older adult as an individual with individual needs, some are painting all older adults with the same brush, presuming that they are all frail and a risk, using belittling or patronizing language, and reducing their sense of empowerment and autonomy. So at Sage, we are putting our knowledge, resources, and supports in actual facts, rather than these ageist beliefs. Often people don't seek out Sage until they need our supports. So we really strive to foster the relationships with them so that they stay connected to our community and continue to be connected to resources, opportunities, and to each other. And we do this by employing a holistic approach, which is really about working with the whole human being. It's about understanding that a person can be simultaneously strong and vulnerable. It's also understanding that someone who may be needing housing support could also be interested in learning new skills, such as learning how to play the ukulele or taking a computer class. And what we're really talking about here are our key values. So these are our key values: asset base, which means that we listen for, celebrate, and help mobilize the unique gifts, aspirations, and strengths for seniors. Relational, we take time to deeply understand seniors as holistic, complex, multifaceted individuals who have a spectrum of needs and strengths. Co-creation, we work with seniors in a reciprocal and co-creative manner that recognizes and draws upon the shared wisdom and expertise of both staff and seniors. And at the end of the day, we really value self-determination. We believe seniors must self-determine when, how, why, and what it means to create positive changes in their lives and communities. So this is what it looks like in practice. Our programs and services are categorized into 4 areas: social, health, community, and support. And this diagram shows how intertwined our programs and services can be with each other. So for health, our programs are centered around seniors' physical and mental health. I'll kind of go through a little bit of some of the areas, and you'll see some overlapping here. I'm also going to pay specific attention to certain programs that we offer. So our Health and Wellness Forum was an event that we have made available virtually. This would be our second year having this event virtual. In the past, we had it in person, and it's a conference where seniors can learn about various housing opportunities, government programs, and even learn how to identify scams and phishing emails. This forum is a really great way to access information and ask questions and have them answered by skilled members in the community. And it's not only for seniors, it can be for those who older children who are taking care of their parents. It could be healthcare workers or anyone kind of working in the senior sector. Our Friendly Call program is something that we also initiated at the pandemic, and it's a way to support isolated seniors, whether it's just a friendly call or to listen to those cues to let our volunteers know that other supports may be needed. The Friendly Phone Call program is all volunteer led, and it is a really great way to kind of combat loneliness, and especially during this time of isolation. Managing mental health, which is kind of connected to our Friendly Call program, as well as our outreach program. And it's part of our long-term social work program that ensures that the conversation of mental health is always part of the assessment. So we're not just looking at basic needs, we're always trying to keep an ear out for mental health. Our food services program actually did get adapted to pandemic response, and that's just a great way of showing how we can pivot to the needs that are currently required. I wanted to spend more time on talking about aging in place in our Dragonfly project. So aging in place is a way that we have collected information on resources, organizations, and services that can help you age in place. And so thinking back to the eco map, we definitely use that as a way to organize information. And aging in place allows for seniors to have access to the services and health and social supports that they may need to live safely and independently in their home and in community. Our Dragonfly project is a new initiative to SAGE, and this is a project that connects seniors who may be falling between the cracks and may be on the cusp of requiring more supports. So this is a pilot project that looks at addressing frailty. Sorry, I just saw the question here. I'll definitely keep that in mind, but we really do strive to just help as many older adults as we need. And so we don't have an age limit. And so for this Dragonfly project, this is a pilot project that looks at addressing frailty through a community setting and identifying frailty through non-medical and social services staff. So throughout this program, we've worked with a lot of seniors and a lot of health care professionals and helping seniors navigate frailty. So this is our clinical frailty scale. This Dragonfly project is based on this frailty scale. And what our coordinators do is they assess seniors along this scale, monitoring seniors and connecting them and helping them navigate not only health supports, but social supports so that their health does not dip to a danger level. And when assessing frailty, they use the acronym AVOID. So they look at activity, if one is vaccinated, optimize medications, interactions, and diet and nutrition. So it's a really well-rounded way to assess frailty. And currently our team is in the early stages of planning the next steps with tentative plans on leveraging the success of the Dragonfly project towards a new frailty identification and intervention. And we did offer referrals, but now anyone who's interested in learning more about this project and being assessed can check in with our social work team. And I'll provide some phone numbers as well at the end. For community, we're not only connecting older adults to resources and information from organizations within the community, but SAGE is fostering community-based senior leadership with programs such as multicultural program and volunteer program. So fostering community-based senior leadership, we are talking about the Aging with Saging program in terms of really empowering seniors to create programs based on their needs. Our volunteer program is a crucial part in our organization. As I'll mention with our income tax clinic later on in this presentation, our friendly call program, which I mentioned before, and our life enrichment programs, they are all volunteer led. And it is really shows just how community driven we are. We wouldn't be the same without our volunteers. And in that engagement, we also connect with and have partnerships with universities. And one in particular, University of Alberta, we connect with students through their community service learning program. And that also helps with intergenerational collaboration. Our multicultural seniors outreach program. So we have 13 partners in this outreach program from various communities, and we help them navigate these systems. So these are stakeholders in the community, not necessarily social workers, but they are leaders and connectors. So we are really just connecting them to make sure that they can break through any systemic barriers that they're facing. Another big part of our community programs is the Seniors Directory. So everything that you might want to know about services and resources for seniors in the greater Edmonton area is all found in these 300 pages in this directory. And this has been the most comprehensive seniors resource guide in North America for over 35 years. And this information gets updated annually. And we usually distribute around 45,000 copies. And however, with this year, we have postponed production for our 2021-2022 print copies of the directory, but we are still continuing to offer either mailing the directory across locations. There's also pickup locations across the city. And we also have the directory available online. All of our information is still up to date, and it can be accessed in different ways as well. For support, our social work team is connecting with seniors through our main intake line and are assessing these calls holistically. We're not just looking at the issue presenting in the call, but we're also looking at other areas in their lives that, that may need support. So assessment and support, most of our assessments come through our intake line. Everything is filtered through this one line and then categorized. The social work team then assesses these calls holistically and matches the caller with areas that they need support in. We have our guardianship and trustee program, which supports seniors with application process of guardianship and trustee. The Directory of Senior Services, as I mentioned before. And I do want to mention our income tax return in the next slide, but I'll quickly mention about our senior safe house. So it's a unique group housing model aimed to support seniors leaving elder abuse. So seniors are able to stay for 2 months and are provided with resources such as financial and housing support to help ensure that they are successful in leaving. You don't have to stay at the safe house to be supported leaving elder abuse. And this is like one of the very crucial parts of our organization, as there's a lot of complexities when dealing with elder abuse. We also have outreach to isolated seniors, and we also have a hoarding program that helps seniors with hoarding behavior. It's called This Full House, and it's a program that supports seniors who are experiencing hoarding. Even during the pandemic, we still provide one-on-one support and group counseling. For our income tax program, SAGE is continuing to offer free income tax services year-round for low resources seniors. We have a team of skilled volunteers who complete the tax preparation work. And then we have our SAGE staff provide oversight and coordination, helping over 2,000 seniors file their tax returns each year. The tax clinic is open to anyone 55 years or older who are Alberta residents with an income under $35,000 if single and $45,000 if married. If they're on age, it doesn't matter how old they are. This is a free service and membership is not required. And we are about to start our 2021 tax returns. But also to keep in mind is that you can also file tax returns from previous years. We are doing this service through appointments over the phone only. And we do taxes for a lot of low resource seniors. And we have many seniors tell us that they have no idea how they would file this year without us, especially during the pandemic, possibly working from home. There is a lot more complexities when it comes to filing taxes in these years. And so it's nice that we have this support during this time. We also work with a lot of social workers who have clients in hospital or in other care facilities, and we can help them with tax returns for their clients. So funding will not be cut off, and that's a big crucial part for sure. So bookings for the income tax clinic will begin very soon in February, I believe February 14th. And appointments will begin March 1st. And they are available to any qualifying senior in Alberta, including those who are hospitalized or in care facilities, as I mentioned. And services will be offered primarily by phone. And a few eligibility requirements. So you cannot have income from rental properties, farming, or capital gain. This is a simple return. So it's working with T3, T4, and T5 slips. We work with seniors age 55 and older, but if you are on age, you can be younger and we can still support you. And couples must file their taxes together as well. And you're not limited to one filing a year. And this is a year-round service. So this is, it's nice that we can have this year-round, especially if those who were unable to file taxes in previous years need support, and also need to file their taxes to gain or continue funding. For social, we are connecting older adults to programs where they can feel included, and also encourage opportunities for us and community members to connect with them and to learn from them. Our Aging to Saging program is specific to Northeast Edmonton and connects low-income seniors to groups and projects, partnerships and funds, education, community outreach, and training. As I mentioned before, our Friendly Call program is our way of combating isolation that older adults are experiencing during the pandemic. We actually connect with 1,000 seniors across Edmonton currently. Another great social aspect is our coffee group, which is part of our life enrichment programs. That has moved virtually as well, and it's just a nice way to connect and have more social interactions. Same with our Men's Shed program. It's our men's seniors group, and we are now offering this virtually as well. And our ability to offer these programs and social kind of connections virtually has actually opened more opportunity for us to connect with groups outside of Alberta. Our life enrichment program is a main example of that. So we have moved as many of our programs from in-person to online using Zoom. In terms of accessibility, those who do not have access to a computer can still join by phone. And as I mentioned before, we manage our programs in a unique style because it is volunteer-led. And the reason for this is so that our programs can be or almost free without membership, because we recognize that cost is a barrier. And having our life enrichment programs volunteer-led also allows seniors to give back their own skills and talents into the community by leading these programs and connecting with other seniors. So kind of circling back to our vision and mission statement, our life enrichment program is a great testimony of older adults feeling empowered to the point where they are collaborating and giving back to the community and engaging and participating in the community. And And yeah, we also noticed that there was a steady increase in engagement as seniors re-engage with their pre-pandemic support networks through online and call-in programming. And we welcomed many seniors, many new seniors for the first time, those who have lives outside of Edmonton or is navigating accessibility. We're able to kind of reach a larger, we have a larger reach now that it is virtual, which is a silver lining during all of this. And as I mentioned, we observed an increased engagement among caregivers, men, individuals experiencing mobility impairment, seniors living in rural communities, and increased international connectedness among seniors living abroad. And I always like to end with just ways of how we can get involved. As I mentioned, we love volunteers, and volunteering with SAGE allows you not only to increase social connection and participate in the community, but it allows you to feel empowered and give back. And it's a great way to kind of be part of this community that we created. Donations go a long way. We are very mindful that cost is a barrier for a lot of people. And so through donations, we are a charity. We're able to give and have our programs and services at either free or at very little cost. Other great ways to connect is through online. So we do have a website, mysage.ca. We also have a Facebook page, a Twitter page, and Instagram. I believe we have LinkedIn as well. And I would say Facebook is our primary social media network. And we always like to kind of post some updates on there as well. On top of our website, we'll always have updates. If you don't have access to a computer, I know someone who does not have access to a computer, you can also call our SAGE intake line and get information that way. And another great way to get involved is to become a member. One kind of community social resource that we offer that I don't think I mentioned is our SAGE newsletter. And so it's a quarterly publication that gets distributed to our members, either by mail or email. It also lives on our website as well. And it's a great way to keep updated on what is happening in terms of our life enrichment programming, updates in terms of our reopening strategy. There's some information about income tax there, and other great kind of events that are happening within the city. So these are all great ways to stay involved. I'll leave this page up. It has a bunch of information like our general email address, our intake line, specific phone numbers in terms of assessment and support, and contact information for our elder abuse safe house and our Dragonfly project. I'll also share with Eric and Kim after this this session, information sheet that has all this information and phone numbers as well. If you would like to print it out, you can do so. Also, I'll share a little feedback survey after this time. That's optional. But yeah, I hope this gave you a little bit more insight of what we do. I'd love to answer anyone's questions if you have.
Super. First of all, thank you so much, Lorelle. And full disclosure, I've been a volunteer and a social worker and a strong supporter of SAGE for quite a few years. So I can fully vouch the level of acceptance. And I went in as a gay man and they said, that's wonderful. We want to be more inclusive. So I'm not trying to do a second presentation aside from Lorelle, but I just want to tell you that it is a really well-run organization that deeply respects everyone. Their community work is fantastic. The Edmonton Pride Seniors Group has received some support, moral encouragement, a little bit of bookkeeping, other things from SAGE. Very much community focused. So I just wanted to throw those a couple of items in way of saying thank you to Lorelle for presenting so well. We do have, so if you have a question, perhaps you could either electronically raise your hand through Zoom or type it into the question or the chat box. So there's two questions there. The first is the minimum age, which Roy put up, and Lorelle answered that. No, I mean, when I was doing social work there, I was told anybody that comes in, please help them to the greatest of your extent. However, there may be some limitations. For example, CRA says for our volunteers to do taxes, that volunteers should be 55 plus. Some housing providers might have age restrictions as well. So that's it. SAGE associated with the ELA, the Edmonton,
Yes.
so
Edmonton
please, you can
Lifelong Learning Association.
Mhm.
It's interesting. Earlier last year, we did connect with a member of ELA, and we're always working to find ways to collaborate with them. So they are kind of a lifelong learning association, and they have programs which seniors can attend for. And I believe they're also volunteer run as well. And those collaborations, you'll probably see it more when it comes to our seniors forum, our health and wellness forum that will happen later this year. And we also share to our members any kind of upcoming courses that they offer. But I know that they're great.
Okay, does SAGE have much involvement with immigration services or newcomers to the country?
Yes, we do. We do support those who are new to the country, more specifically as well with our Aging to Saging program. That's more specific to Northeast Edmonton. And so in that area, we do have a lot of new immigrants, and we do kind of work one-on-one in that area to just provide more support. And if they're, because we also have that one intake line, anyone who's needing specific services, we can connect them to those.
Any other questions? I know that, again, SAGE's connections in the community through they're connected to the multicultural health brokers, to the Edmonton Mennonite Center for Newcomers, to Catholic Social Services. Really, what SAGE does when you call that line is they act as a marvelous connection service of, maybe we don't actually specialize in that part, but the Edmonton Mennonite Center for Newcomers, they're really good at this part. Let me give you their number and you can speak directly with them. Call us back if you have any issues with that. That's the type of thing that SAGE does. Very, very connected and well respected within the community. Again, I will shut up because
the way you're explaining it is perfect. We do have a lot of community partners, as you mentioned. And so if we don't have the answer, we will make sure that we connect you with the specific resources and our contacts. We've been an organization for over 50 years now. And so, and also it's kind of interesting to know that we're the only inner city senior services located downtown. So we definitely navigate a little bit different than other senior serving organizations. acting as a charity, but also as a way to access knowledge, information, and support.
Larry's question, something dear to my heart, any chance the nurse practitioner program will be reinstated?
I wish I could answer that or have more information on that. Unfortunately, just with the nature of grants and funding, we did have to close our health services, but that's not to say we're not fighting to try and get it back. And I think part of that speaks to just the need to be treated as an individual, especially as a senior who has individual needs. Navigating the healthcare system can be challenging, and so I do feel like that touches a soft spot in my heart. It really was a big part of our in-person location, and I hope we can get it back soon.
I certainly hope so as well. It was a grant program, a temporary thing that was put through Alberta Health. And so hopefully they'll have a chance to relook. From a social work perspective, it was absolutely wonderful to have seniors being able to be referred by a social worker to a nurse practitioner and being referred by a nurse practitioner to a social worker. It was a very good holistic service. So fingers crossed.
Yes, we're still very close in connection with our nurse practitioners and those who worked in the health department at Sage. And so fingers crossed for sure.
Doriana, do you have a question?
Hi, everyone. I just wanted to sing my praises for this because I'm just so grateful to have discovered Sage. I mean, I have attended a couple of events there in the LGBT community, but just really feeling the need to reconnect and possibly serve in some capacity and time as well. But wow, what an impressive, all-inclusive space that you guys are providing for everyone. All these links and all, it's like you're just providing a solution for all the barriers that we do face and that are, they affect all of us seniors in ways that sometimes you don't know what to do with it all, especially if you don't have family around, or if you're single, you don't have a partner. There's extra vulnerabilities and all these things, going through this also. I'm very much appreciating it. Thank you, Lorelle, too.
Oh, thank you.
Does anybody else have anything to say? Thank you so much for that, Doriana. I mean, I think for so many seniors in the LGBTQ community or elsewhere, it's just a question of, I need a bit of help, but I don't know where to go for it. And the advantage for Sage is they know everything. Really, so many different connections, so much knowledge about the senior serving community, and also doing it with an inclusive, anti-oppressive lens. The one thing I want to plug is the tax returns. I know that some, particularly seniors, can suffer from depression and anxiety and may not have filed their taxes for a year or two or more. If anybody ever walks into Sage and says, I'm so embarrassed, I haven't filed my taxes for 2 years, the only thing they're going to hear is, I'm so sorry to hear that. How can I help you? That's the answer for everything at Sage is, I'm sorry to hear that. How can I help you? And recognizing that it does happen that people do get a little bit behind on their taxes, and it can impact guaranteed income supplement or their OAS payments. So please spread the word to your friends and colleagues that if they are a low resource seniors, that they can get their taxes done at Sage, and multiple years as well. Sorry,
Oh, thanks,
I
Eric.
keep saying I'm going to
No,
shut up, but I never
you know
do.
what? That it really just everything you said, Eric, it makes me think of just like how special Sage is, and especially with like that individual care. And I think another kind of unique quality that Sage has is they really take the time to build trust. Because you're seen as an individual and you have that one-on-one connection with the social work team, or maybe you're just getting your feet wet with a life enrichment program here or there, or maybe some volunteering. It's not like we're pressuring you to join every program or services. It's more kind of like allowing this safe space for you to access and these resources to you for you guys to be just like available without any kind of like barriers, and really try to reduce the barriers as much as possible, especially like I think of just like the role that ageism plays, where you feel disregarded in, you know, society, you're kind of outcast. There's labels kind of like placed on you over something so arbitrary as age, and it doesn't speak to your health or to your life and to what you're contributing. And so I think it's the way that we navigate all of the services that we have, it's in a way that is respectful and inclusive. And we still strive to be more inclusive, especially with things moving virtually in terms of our life enrichment programming and our health and wellness forum. We started to think of ways of how can we better support those who have hearing impairment, which is like trying to get closed captioning during our special events like the Sage Awards, and also having things accessed like written on paper as well as online for that accessibility too.
Larry, you had a question.
It's as much a comment, I guess, the question. I live in a seniors residence, in fact, just around the corner from Sage, and while there are a number of GLBT people here, there's also probably an even larger number of seniors who have learned that children or grandchildren or people they have that are important to them have come out as GLBTQ2S plus. So and because I am openly gay, I get to hear some of these stories, and it does strike me that's another group, obviously connected to us, who do have real needs that are probably unmet. I wondered if you had any comment on that, Lorelle, or whether you found some of the same experience.
That's a really great point. I know when talking to Rachel, who is our life enrichment coordinator, she did kind of like mention that even just having groups available where you're allowed to ask questions, and like we have kind of those in the LGBTQ plus community who can answer them, that's a really big step for sure. I don't know if we are currently having any communications like specifically to for those who maybe have younger family members who, or like new generations who are in the LGBTQ plus community, but I feel like that could be a really good life enrichment program, or even a nice session like in our seniors forum to start discussing.
Yeah,
I would love to see that discussion in your seniors forum. It would be, I think, very well received by many people.
Me too. I mean, why not? Because we have sessions where it's like how to navigate phishing emails or how to become more computer literate. And so why not have information about how to be more inclusive? And I mean, I don't know if you know, but Eric actually did a presentation during last year's seniors forum talking about just that, how to be more inclusive and be more open. And it is on our YouTube channel, I believe. So not to plug our YouTube, but it's a really great session. And I still remember, Eric, some of the questions that you answered during that session. And I think one question was just like how can I be more inclusive, or how can I be more open, or what if I'm not open? And the way you answered was so eloquent and so kind and compassionate.
Thank you. I'd like to say that, you know, just make an example of the inclusiveness of SAGE and why I want people to go there is the Over the Rainbow group, which met in person. There were some people who would walk in, look around, make sure nobody knows that I'm coming in here and to meet with that group. But after a couple of months, what I noticed is that these people who were joining the Over the Rainbow group were also going on the bus trips to the casino, on the bus trips down to the Holden Theater group, to many different locations, because they felt the safety of SAGE overall. And that is the one thing. And yes, if you'll tell Rachel on any upcoming seniors forum, I'd be more than happy to talk again about how to be. So I think that's a really important topic, how to be supportive of children and grandchildren who are coming out or who are questioning and that sort of thing. So, okay. It's 11:52. We're almost coming to the end. I want to plug next week's session, which is Duncan Mills speaking about Prime Timers, which is a group for older senior men, LGBTQ men and their friends, which has been going on in Edmonton, I think, for 25 or 30 years. So Duncan is going to be talking about that, some of the social activities that take place. So with that, if there are no other questions, what I'd like to do is thank you, Lorelle, so much for speaking about SAGE. A wonderful presentation, and I hope so many people will get connected and spread the word among their friends and colleagues. If there's no other questions, I guess at this point it's, remind you that you will be getting a survey in the mail. We'd really appreciate it if you'd sign up for, if you'd give us your response. By analyzing your responses, what we try to do is make our presentations more responsive to the community's needs. With that, Larry, do you have any final comments?
So thank you all for coming. Thank you, Lorelle, for a very informative and important talk.
Thank you.
Thank you.
Thanks very much. Bye-bye, everyone.